Hello, everyone. Welcome to DataKind's webinar today on Climate Health Pulse, where we will also be doing a demo of our prototype. We have lots of people just logging in, so we're going to give it a minute before we get started. Hi again, everyone. Welcome. We just have a few more people joining in right now. We're about to get started in about 30 seconds. Um, so stand by. All right. We are ready to get started. We might have people joining as we go, but we can get started. All right. So again, hello everyone, and welcome to DataKind's webinar and demo of Climate Health Pulse. I'd like to kick things off today with with thanks from all of us at DataKind. Thanks to you all who have joined this live, and also to those who will be viewing this recording later. I also want to thank our partners on this project. So Spectrum Africa and Jacaranda Health. I'll tell you a little bit about them soon. And thanks to the many contributors who have been instrumental in shaping the research that has gone into this, the analysis and insights that have underpinned our work. So your collective expertise has really been invaluable in our efforts to explore and develop practical solutions that address the challenges at that nexus of climate and health, as well as other areas. My name is Tali. I am the director of our global portfolio of work at DataKind. We are a global nonprofit organization focused on closing the digital technology gap in the social sector. We collaborate with highly expert people and impactful organizations to develop sector-facing products that advance our mutual commitment to building a more just world through responsible and ethical use of data science and AI. I'm also joined by my colleague Mallory. She will be sharing links and resources along the way as we go through our presentation. The solution that we're going to demo today has been developed in collaboration with our partners. So I'd love to tell you a little bit about them. First of all, Justice Ogando, he is the founder and executive director of Spectrum Africa. Justice is a seasoned global health, market access, and climate change expert who has worked all across Africa. Justice has really been instrumental in uncovering hidden connections between climate, health, and the well-being of people. Justice brings together diverse sectors, lots of different actors into our sort of advisory group that really helps us to create impactful initiatives that address our most urgent climate and health challenges. Jacaranda Health, as you might know, they work to ensure mothers experience pregnancy and childbirth safely and with respect, and that all newborns get a safe start in life. They partner with governments, public hospitals, and other facilities on solutions that improve maternal and newborn care. They also partner with mums. Their flagship prompts platform supports over 2.4 million new and expecting mothers through their two-way SMS exchange, where they get to send, stage-specific pregnancy messages to mums, but also respond to mothers' questions in real time. We wouldn't be able to show you the ways in which climate and health data can come together without the support of Kajiado County. So Kajiado County is located in southern Kenya. Um, its plains and valleys and hills are home to over 1.1 million people, phenomenal wildlife and biodiversity, of course. But Kajiado faces its fair share of climate-related challenges, including heat stress and water scarcity. So climate change in Kajiado County and around the world is a current and escalating health crisis. It is projected to be responsible for 250,000 additional deaths annually. Recurrent droughts, erratic rainfall, heat waves, all of these directly impact health. And in some cases, climate change is increasing the risk of climate-sensitive diseases. In other cases, it is disrupting the seasonality, making it harder to anticipate when diseases will strike, specifically where and to what extent. This is now known, and health systems overall, especially in climate-vulnerable regions and at more local levels, are already facing this increased strain from these climate-related health impacts. It is no longer a question about whether we need climate data for health, but rather how can that actually be translated into action that supports better decisions and outcomes at scale. Last year, DataKind spent about 10 months in dialogue with a variety of experts, health managers, researchers, policymakers, and frontline health organizations. And this was across geography. So we spoke to people in Africa, Asia, Europe, and North America. Justice actually brought a really critical perspective to this work, framing climate and health at the nexus of an ecosystem that actually touches almost any other sector, be it food security, agriculture, livelihood, finance, wash, etc. What we heard from multiple perspectives was that health stakeholders, and especially across the global south, recognize the need for and are actively seeking climate-informed health data to support decision-making processes. But despite this growing demand, there is a critical disconnect. Many actors are tackling pieces of the problem, but the data remains fragmented and it isn't reaching the people who need it most. Those health system managers, health workers, and the communities themselves that are impacted. This disconnect persists for several key reasons. Climate and health sectors have traditionally operated in silos with deep structural differences between their data systems, formats, governance models, and there are lots of efforts underway right now around the world to really help bring together the climate data and health data. There are advances in how to pair climate and health data as well, including work that DataKind did about 2 years ago with the Office of National Statistics in the UK on open source methodologies on how to pair climate and health data. We also know that while 74% of meteorological services report providing climate data to the health sector, only 23% of health ministries actually incorporate this data into their decision-making processes. And then another final, reason for that disconnect is even when that data is available, it's the localized real-time information that is rarely, especially climate information, that is rarely sort of integrated into current and existing health system workflows where it could have the most impact. So this represents, a significant missed opportunity to strengthen health system resilience through better data integration and knowledge sharing across sectors. You can read a bit more about these challenges that limit climate and health data integration, as well as some of the promising innovations from around the world in the full report, either by scanning this QR code that's on your screens. You can also use the short URL that's provided, or you can also click on the link that's being shared in the chat now. You can also read the highlights in the Tech Change blog post that we also have up. The URL for that is also going to be shared in the chat. What you'll note in the report, though, is that while the ecosystem, yes, is fragmented and siloed, government agencies are in fact absolutely central to data access as well as data utilization. Questions around data availability, interoperability, capacity are, yes, persistent, but they are solvable. And while resources are limited, we can focus on feasible, cost-effective, user-friendly approaches that strengthen existing capacity, as long as there is local leadership, there is equity, and sustained collaboration. Okay, so what if we integrated climate and health data? What could that unlock for us? So rather than thinking of a narrow tool that brings these data sets together, DataKind and our partners, we're working on an integrated platform that unlocks that ecosystem level thinking, that enables cross-sector alignment and iterative learning. With this, we get to move from purely a space where we're understanding risk to acting on it, and from potentially unlocking, differentiated strategies by geographic location or by facility, and also by having this evidence drive the research agenda and enabling people to get curious. The first step towards that vision is Climate Health Pulse, which is what we're here to talk about. Climate Health Pulse brings together climate data and health indicators at a granular county and sub-county level. In this iteration, Pulse, as we call it for short, exists to make climate and health data useful, usable, and actionable for local governments, for implementing partners of governments, for health workers, essentially empowering them to take timely and effective action against climate risks before they translate into adverse health outcomes. Pulse is not just about a particular data source or just health or just climate. While the prototype right now is very much focused on showing the interaction between climate data and health data, it is about layering on multiple sources of information to create that actionable climate-related intelligence. It is a solution that is designed to evolve with new partnerships, new data, new indicators, new geographies. And to that end, we're developing Climate Health Pulse per digital public good standards so that it can be used by many different types of actors as well. All right, with that, I'm actually going to give you a demo of our prototype. Let me just screen sharing for a second. All right. So this is pulse.datakind.org. It is a web-based tool, but also it's also optimized for mobile phones. All right, let's get started. This is the main landing page for Climate Health Pulse. It essentially here contains information about Climate Health Pulse, including the information I've shared with you. And then if you scroll down, we get to our featured prototype, which is Kajiado County, Kenya. In our prototype, we have quite a few different data sources. We have got health data from the Kenyan Health Information System, specifically from Kajiado County. We have also got facility lists and facility location data from Kajiado County as well, which includes 116 active government-owned health facilities that are currently active around the county. We also have climate data. This is currently sourced from the Copernicus ERA 5 satellite reanalysis data set. This is actually a really crucial and free data set for climate research, offering very consistent data on temperature, on wind, precipitation, and more at a fairly granular level, about I think it's got a 9 by 9 square kilometer resolution. But we also have forecast data from KMET, Kenya's meteorological department, and we are also in discussions with them to actually try and figure out how we can get even more granular data. And Finally, we also have data here from Jacaranda Health's Prompts program. Now, mothers across the country ask thousands of questions about their pregnancy or the health of their babies. And Jacaranda Health uses AI, natural language processing, and other mechanisms to actually classify the data that's coming in, the questions that are coming in, into subject matter classifications. These are now in our tool aggregated at the ward level, so we can really have a look at what's coming up, what are moms concerned about at the ward level. Over time, this data provides a sort of community report of the issues facing mums across the country. All right. With that, let's go in and explore the tool. Now, at this point, by the way, this page is going to be publicly accessible. You can all log into pulse.datakind.org and have a look at this page. However, to move further, at the moment, you would actually have to be one of our partners with permissions to be able to view this data to actually log in and play around with the tool. But we are working on a publicly accessible version of this as well. All right, so welcome again to Climate Health Pulse for Kajiado County. This here is the overview page. What you're looking at here are 4 layers of information that we can look at. On the left, a map of Kajiado County and all the wards within. You can have a look. The map is great because you can actually see the geographic location of these health indicators and their relative impact. So using color, we can represent, the data values across the wards in the county, and it's already easier to sort of start to visualize patterns, variations by data, and look at where there might be hotspots or trends. You can really spot them fairly quickly. On the map, you can also see we have the health facility locations included. So you can actually click on those. And right now we have fairly basic information about health facilities here, whether, it tells you a little bit about what kind of a health facility it is. For instance, here it's a dispensary, and you can look around. You can also see that for basic health centers or even hospitals, it will contain information about things like number of beds or cots. This can obviously be, edited. It can be changed to show and display information that is actually more relevant to decision making, particularly when it comes to thinking about the different ways in which specific facilities might be supported. On the bottom here, just below the map, is just a simple line chart, essentially, that shows the health outcome trend or the health indicator trend over time. This is also from CxH. On the top right is the climate data. This includes total precipitation for any given month, as well as average daily max temperatures for that month. And you can toggle on and off depending what you want to look at. You want to look at both of those together. You want to look at just temperature or just precipitation. And finally, below down here, you have the community reported trends. Again, simple line charts that really just show trends, but also you get to see down the left the intents. So you really get to see what those, what mums might be concerned about by scanning through here. All right, let's come up to the top and look at a couple of use cases. Now, before we dive into that, I just want to show you a couple of other features. You'll notice that we can also look at data for different time scales. You can look at the past 12 months, any period of 12 months, really bring it down to 9 months. So you also get a chance to explore data at different time scales on this. You also get to drill down, look specifically at sub-county level data, or get really down deep into wards and see and figure out what's going on at that ward level. Depending on what you're looking at or what you're exploring, you might want to be able to show something or share it with key people, with other colleagues, maybe share it in a report, put it into a blog post. So again, from a user perspective, just thinking about ways in which you can just download these visualizations, plug it in to different reports and systems that you might be pulling together. All right, let's scan back out, and we look at malaria is a climate sensitive indicator. So let's dive into malaria a little bit, and we'll look at it over the entire date range that we have here. And again, you just drop down into the indicator and select, and we can see immediately the geographic differences between confirmed cases in various wards. In the north part of the county, we can see that reporting of confirmed cases seems to be particularly high relative to other areas. And we can get a closer look and see how that data, how the malaria cases, confirmed malaria cases changes over time by just playing it out. So as you can see, there are the thresholds of these colors right now. We've just selected them fairly arbitrarily, but you might be, depending on who you are, where you sit, you might have specific thresholds in mind that you want to look at, and those are also adjustable so that you can see how the cases are reporting, where the hotspots might be, and what your threshold is to call an area, a region, a ward, a hotspot. Now, let's dive in a little bit closer into this north part of the county here to see what's going on. Again, if you just dive in here, and if I just play that animation again, you get to see not only what's happening in the hotspot ward of concern, but also get a sense of what is happening around in the neighboring wards as well. There is obviously a lot of flow. People move from one ward to another. They go from one facility to another, depending on where they live and so on. So you get to actually see what's happening and whether there are facilities that might be overburdened at certain times, such that there is maybe a strategy available to support facilities in neighboring wards as well to help reduce the strain and the burden. Now, again, if we just stop this here and let's dive in a little bit deeper into this particular ward by going in there. Okay. So you'll notice when I go into the ward level, all the other layers of information automatically also adjust to give you that ward specific information. So right now what you're seeing is climate and precipitation or temperature and precipitation data for this ward. You're looking at confirmed malaria cases from ChIS's data from this ward, and similarly, the community reported trends at the ward level from the prompts data. Now, January, I believe, is said to be the typical onset of malaria season in Kajiado. So it's after the rains and sort of when there's this period of increasing heat. So on the map here, I'm going to look for the January 2025 just to see what's going on. Now, when I click on this, I have, of course, the information. Average precipitation that month was 58 millimeters. Average daily max temperature was 29 degrees. And this is where we can start to see that, apart from the reported rainfall and temperature, we can start to see on the line chart, the trend line is sort of trending upwards around that period. So we can actually just have a look at what's going on the month before. Yeah, and we can see there is a bit of a jump from 43 confirmed cases of malaria in December to 207. And that seems to just increase in the months going forward beyond that as well. General trend. We can also see on the trend line that there is a peak right here. And if we just click on that, we also get to see immediately on the other visualizations as well what's going on at that time. So we can see here that this peak in reported cases is in May 2025, where the average temperature, max daily temperature for that month was 28 degrees. All right. So that's a couple of different ways to get into it. Let's look at another indicator. So coming back out to the county level, I believe that there was one of the use cases we explored with our partners was looking at malnutrition. Now, in Caggiato County, there was a drought between 2022 and 2023, which was linked to severe malnutrition amongst the population. So if I look at particularly Jan, actually I can just adjust that here and look at the date range. So we're looking at Jan 22 to December 23, which is when there was this drought, and we've filtered down here to a indicator for red MOAC. Red MOAC is a health indicator for severe malnutrition for children under 5 years old. So we get here and we can actually start to see again how those malnutrition cases changed over the course of time during this drought period. And again, where those hotspots repeatedly seemed to come up. Not beyond this, we can also have a look at, community reported trends. So while that's going on, we can actually see what were the issues in that time period being reported by mums? What were some of the concerns? Where the peaks are, what came up for mothers in the way they were describing their concerns. This is not to say that there are any necessary correlations, but it does allow you to have a look at, we can learn what types of community issues are coming up during intense periods, during climate events, known heat events, for instance, or periods of flood, periods of flooding post a period of rainfall, for instance. There are lots of different categories right now in prompts, and I think for the current platform, for the current prototype that we have now, it's really important to be able to scan and explore what kinds of issues are being reported at county level, ward level, sub-county level by mums. So this is also just a really great way to better integrate community voices into exploring what's going on with climate and health. We can also dig further actually into the relationship between periods of intense heat and what mums are reporting, or what other community members, if this was to be expanded to bring in additional data sets from the community itself, we will be able to create visualizations similar to this. In this case here, these visuals show how the intents that the text messages from mums are classified into vary across different temperature ranges, really helping to illustrate how hotter conditions may be associated with changes in health concerns. But beyond looking at historical correlations, how can, say, county health officers use this data to mitigate or adapt to climate-related changes? We were inspired by the work of Carrie and colleagues who used generalized additive models to understand the relationship between temperature and precipitation and maternal and newborn health indicators. And this work was done in the Democratic Republic of Congo. We're going to be sharing the link of that study and journal article in the chat as well for you to have a look at. Here, we essentially replicated their approach, and we explored the relationship between the indicators that we've shown here and climate factors. We use this model along with forecast. Here you can see the forecast temperatures as well as precipitation. And we built the health indicator forecast using this methodology. These models were actually optimized for ward level, but we've also expanded it to apply to county level, and we are definitely still in the process of exploring additional models, validating this model, and so on. So right now there is a nice disclaimer up there that I've put in, basically just to show you that these are experimental and provided solely for demonstration purposes. Now, you can see here that with the health indicators, what we're showing is that the historical data is represented by these blue dots, and then the forecast is represented or projected, um, you know, rates for that indicator projected are shown with these orange dots. You can see that there is a gradual increase in, if we look at malaria, there's definitely a gradual increase in malaria rates over the next year. We note that there are also very high, no matter which indicator you look at, there are pretty high confidence, I mean, pretty large confidence intervals. So again, the model, what that means is that the model has currently a lot of uncertainty associated with it. Again, just to reiterate, we are looking and we would love to work with partners over the next few months to increase the confidence with which county health officers can take a look at forecast data and think about what decisions are within their role, their function, that can be made, or use information to advocate for either additional research, to advocate for policy support and decisions as well. Or even other operational decisions, such as how to intervene with a particular health facility in a particular area or ward, how to support community health workers, maybe thinking about stocks of malaria drugs or other diagnostic tools, and in general, preparing for food insecurity in the area as well. Okay, so with that, I'm actually going to close our demo. And I'll just close it by saying that really Pulse isn't just about technology, it's really a partnership framework. Let me head back into the presentation. All right. So I welcome you all to please go to pulse.datakind.org on your phones, on your laptops, and you can read more about it. As I mentioned, the prototype right now is only accessible to partners. However, we would like to work on developing a version with publicly available data. So if that's something that you'd like to collaborate on, we'd love to chat as well. As I close the presentation, I'd like to say that, again, we are open to these partnerships around a variety of different things, data integration, modeling, validation, of course, but we're excited to engage with you on Climate Health Pulse in other ways. We know there's really a lot for us to learn from all of you, and we're looking to build actually a multi-stakeholder engagement across institutions to support Pulse's development, to support user understanding, adoption, and also impact opportunities. So with that, please consider joining our community. You can click in to select, once you just, get to that form, you can use the QR code that's pasted here. We'll also be copy pasting the link into our chat. So yeah, please consider joining our community. Click in to select ways in which you would like to contribute or suggest ways we might not have even considered. We are looking for folks who understand how local health system managers or health system managers directly to come in and share your insights, advisors, researchers, potential end users, folks who have experienced testing products or prototypes, data professionals, funders and connectors. Yes, please. We'd love to know how we could have this work supported and really build those partnerships. But you can also sign up if you just want to receive updates, you want to know when the next demo is going to be, and so on. So please do come in. With that, I'll bring the presentation to a close, and I'll thank you again for joining us. We are very excited to co-create with you.